You're watching continuing coverage of World Healthcare Congress 2012. Back in 2007, a national magazine listed Oklahoma City as one of the country's fattest cities. Now, the residents there weren't going to take that sitting down, and since then have collectively lost 1 million pounds. I have with me in the studio Mayor Mick Cornett. How are you?
I'm good. Good to see you.
You look great.
We all look like supermodels in Oklahoma City.
How did you do it?
Well, we're really just putting a priority on health, and Oklahoma City had allowed itself to become an example of a community that life revolves around the car. And so I started an awareness campaign about 5 years ago. As you mentioned, This City is Going on a Diet.com. And ultimately, with the help of a lot of other community leaders, 47,000 people signed up on the website. And just this January, we hit the 1 million pound mark.
Fantastic.
And interestingly, Men's Fitness magazine, which had originally placed us on the list, recently did their 2012 rankings, and we aren't on the list anymore. And so I think that validates that we're doing better. And certainly from an awareness standpoint, we're doing much better. People are much more likely to be talking about the subject of obesity than they had been 5 years ago. And I think that's a critical first step.
Do you think, and are you convinced that the city has changed its ways? Now you are on the road to health.
Well,
and
yes, I do, because they've also shown it at the ballot box. We put together a public works package called MAPS 3. And inside of that economic development package, we've called for senior health and wellness centers, the completion of our bicycle trail master plan, along with another project, over 400 miles of new sidewalks, new gymnasiums in our grade schools. We're taking a city where life has revolved around the car and starting to revolve it around people. It's a complete paradigm shift. We had for years inspired our civil engineers. It was their job to see how fast a car could get from here to here. And we've now told them, no, we're not going to design the city for cars anymore. We're going to design it around people. And interestingly, from looking at the Census Bureau, we're now attracting a lot of highly educated 20-somethings from Texas and from California moving into Oklahoma City. And from an economic development standpoint, we're hitting home runs because no longer are people going to where the jobs are going to where the people are. We have the lowest unemployment in the United States and probably the strongest economy per capita of anywhere.
What about productivity rates? Have you seen that people are much more productive since they feel better and more healthy?
Look at it this way. If you're a job creator, if you're an entrepreneur, and you see Oklahoma City on the list of the most obese cities in the country, aren't you going to think twice about creating jobs there? Because you're going to wonder, what are my healthcare costs going to be? What's my absenteeism rate going to be? Do I really want to create jobs in a community that doesn't prioritize health? And I looked at it from, my priorities were jobs and education. And I say, look, we have got to create a culture that values health for a lot of really good reasons. To draw in the human capital that the entrepreneurs and job creators are going to rely on, but certainly to start and create a culture that understands that that's what the economic development drivers are looking for. Health is more important than it's ever been from a community standpoint.
What about the healthcare costs? Have you taken a look at what the numbers look like for paying for diabetes, for instance, and other weight-related diseases?
Yeah, and what I like is that a lot of our employers are starting to put wellness calibers into their motives. In other words, sometimes they're saying, okay, healthcare costs are going up this year, except if you'll take part in this wellness campaign, yours won't go up. And here's the metrics. Here's what you need to do to keep your healthcare costs going down. And immediately, you're starting to see some effects like that. So I think turning the table and realizing it's about wellness and not acute care is a critical step toward healthcare in general and in Oklahoma City specifically.
Are residents convinced? Are they going to stay on this road?
The awareness campaign has worked successfully. I don't pretend to know if we're thinner than we were 5 years ago. Men's Fitness magazine says we are. We probably are doing a little bit better. But I can tell you this, from an awareness standpoint, we're talking about it. Obesity is no longer the taboo subject in the community. It's something that people can talk about in their homes or at church or over the back fence or at the workplace. And I think that's a critical first step in the community revolving life around it.
Mayor, thanks for being here and sharing your story. And by the way, a list did put Oklahoma City as number 23 on America's fittest cities. Thanks for watching. I'm Abel Jones.